A preventable disease just made its unwelcome debut in Grand County, and the timing couldn't be more concerning for local families. Health authorities announced Saturday that Grand County has recorded its inaugural measles case, marking a troubling milestone for the region. The Southeast Utah Health Department revealed that an unvaccinated minor, someone younger than 18 years old, contracted the highly contagious virus after encountering it beyond the county's borders. But here's where it gets controversial. This case represents yet another instance where vaccination status directly influenced disease transmission in our community. According to the department's official statement, health investigators are now working around the clock, meticulously tracking down every person who might have crossed paths with the infected individual. The good news? Educational institutions within Grand County appear to have dodged the bullet. No school-based exposures have been identified so far. However, this is the part most people miss. Measles symptoms don't appear immediately. The virus operates like a biological time bomb, typically taking between 1 to 2 weeks before revealing itself through telltale signs. Health experts are urging community members to monitor themselves closely for these warning indicators, particularly if they haven't received vaccinations or suspect they encountered the confirmed case. Elevated body temperature and fever, persistent coughing, nasal discharge and congestion, bloodshot, teary eyes, distinctive skin eruption beginning at the face before migrating downward across the body. The medical establishment maintains that the most reliable defense against this infectious disease remains the measles, mumps, and rubella vaccination, commonly known as the MMR shot. According to health officials, this immunization demonstrates remarkable effectiveness and safety profiles, typically conferring permanent immunity for the vast majority of recipients. This Grand County case doesn't exist in isolation. Just last month, Washington County witnessed 2 school-aged children testing positive for the same virus, prompting the Southwest Utah Public Health Department to implement stringent containment measures. Educational facilities received immediate notifications about potential exposure risks, while unvaccinated students and staff members who believed they had contact with infected individuals faced recommendations to remain home for a full 21-day quarantine period. And this is where the debate intensifies. Are these increasingly frequent outbreaks a predictable consequence of declining vaccination rates? Or do they represent isolated incidents that shouldn't influence broader public health policies? What's your take on this situation? Do you believe communities should implement stricter vaccination requirements for school attendance? Or should individual choice remain the priority even when it affects community health? Should parents who choose not to vaccinate their children bear greater responsibility when outbreaks occur? Share your thoughts. This conversation affects every family in our region,